professor at the University of Milano, also director in the Institute of Tumors in Milano, and scientific director of the National Center of Oncological Hadron Therapy in Pavia, in Italy. And she's going to talk about hadron therapy and the EU clinical networks. Lisa, we have 20 minutes, so please keep the time, and the floor is yours. Thank you.
This introduction. Thank you very much for the for this invitation. I'm very pleased to be here and to closer to the microphone. Okay. Do you hear me? Yes. Okay. So I will try to tell you a story about what is happening in Europe, and I will also try to tell you a story about what is happening in oncology in general, since radiation oncology is something that has to be done within the oncological community. So what happened in the last years, it's that Europe has organized itself in a network way. It means that these networks are today a reality. This reality started in 2017, and the European Commission set up European reference networks. At that time, the European networks were more than 20 on different topics. One of these topics was the European Reference Network on Adult Rare Cancer. It means that already in 2017, there was a need, an unmet need of the clinicians that has been taken up by Europe to understand that rare cancers has peculiar problems. Think about, for example, education of doctors, education of patients, referral of patients, transnational migration of patients because they need something special. So among these European networks, there is the EURACAN, which is the European Reference on Adult Rare Cancer. This network is a reality. It has a governance, and what I would like to point out is that you see that this network is made up of a general assembly, a steering committee, a scientific advisory group. But here, look at here. So we do have domains which are separating the different diseases. It means that we cannot really think about having a whole network on rare cancer, but these rare cancer are made up of very different histological types, subtypes, unmet needs. Some of these cancers are curable, some of these are not, for example. And here you have transversal task forces. Here to say that the governance do exist for this European reference network. Basically, what is how those networks are constructed? Those networks are relying on healthcare providers, means on big institutions that has been appointed by member states. It means that Greece, for example, has appointed some institution. Italy has appointed other institution based on criteria. The criteria that were chosen by the member states, and they were all adhering to these criteria, were, for example, numbers. So, for example, you need at least 100 sarcoma patients to be seen in order to be part of this network, because what the aim of this network is to improve, basically, to improve care, as you see here. But there are also some other activities, such as empower involved patients, multidisciplinary advices for complex cases, writing clinical guidelines, and some of the clinical guidelines that you have seen this morning stems from EURACAN collaboration, from this collaboration. So it's ESMO-EURACAN collaboration. Disseminate knowledge and, of course, promote research within this network, epidemiological surveillance, but not only, by setting up shared registries and also national centers and networks. So the idea basically is to construct a network that is based on national networks. Based on the epidemiological surveillance, and based on the fact that everyone here is asking for registries, we do have international registries, and we do have registries for sarcomas within the Eurocan, within this network, as well as for rare head and neck tumors. The philosophy between the two different databases, registries, are that the sarcoma registries are trying to put already existing registries together, while the head and neck, the experiment on head and neck registries was to build one registry from scratch and having it distributed all over Europe, so that the patients could be entered in this common database. It's important to say that nowadays we are not speaking about keeping our data, sending our data away in centralized repository. We are keeping, every institution is keeping own data in own repository, and how we work, it's through the centralized sources with exchanges of data. It means that we are resorting to federated type of approach. And this is a reality. This is how Europe now works, at least for two types of diseases. So this is the model on rare cancer, on the European Reference Network model: sustainability, integration between healthcare and research, integration between EU networking and member states, integration between IT tools and the European and electronic health records, and of course patient involvement. So according to all these points, Eurocan is really working at every level of this point. There is another story that I have to tell you, and it is the Beating Cancer Plan. Every one of you knows that the Beating Cancer Plan is the first attempt of Europe to set a series of expectations that the oncological community should respect in the next years. So with the European Beating Cancer Plan, it was stated that there should be, beside the European Reference Network, also the Network of Expertise, which is different. European Reference Network are for oncology are related to rare cancer, while the Network of Expertise is something different. This stemmed from the experience of the European Reference Network. And they would like to start with two joint actions. So in order, Europe says you have to organize yourselves in network of expertise, and we will see what those network of expertise are. And Europe asked the oncological community to do this through two joint action. One is JANE. It's a network of expertise on cancer, and the other one is CRANE, which is the European Network on Cancer, on Comprehensive Cancer Centers. JANE, so I will now focus on JANE, the joint action that somehow in which CNAO is fully involved in JANE. So the European Commission told the oncological community, it's something that we have not invented, so we have got it from Europe, and Europe has asked us to organize oncology within network of expertise for prognostic cancer, personalized prevention, survivorship, palliative care, adolescent young adults, omic technology, and high-tech medical resources. So we are here at this point, we are starting this activity within a joint action to construct for Europe network of expertise. When it comes to high-tech medical resources, you do have different subdomains, which includes innovative radiotherapy, and I think you are here for that, nuclear medicine, radiomics, innovative surgery, ablation, cell therapies, and ex vivo testing. So the networks that has been requested by Europe, by the European Commission, are on poor prognosis, personalized primary prevention, survivorship, palliative care, omic technology, high-tech medical resources, and cancer in young adults. So it means that the organization of oncology in the next years will be completely different from what we think. So there is an attempt by Europe to try to organize our activities, the oncological activities, given the burden of cancer. So I don't have to tell you about why it should be done like this. But this is a full request by Europe to organize ourselves in a network of expertise on these topics. So there are grants that are supporting this activity, and here you have clearly this is the grant that was given to that was approved by the European Commission on healthcare networking. Of course, it contains challenges and possible solutions, wide involvement of the EU oncological community. And what it is requested by Europe is a driving force for universal access to care. So the challenge here is to have the universal best care for our patients. So clearly this joint action is constructed according to deliverables and to milestones as a classical European grant, and you have central services, a work package on sustainability, dissemination, and of course evaluation. What are network of expertise? While Eurocan is something which is made by healthcare providers, so doctors that are speaking each other, are giving advices for complex cases, for example, rare complex cases. Here, the idea of network of expertise is to construct infrastructure, an expert infrastructure that can drive or help out the community to build to build knowledge and disseminate and better care in the different network of expertise. So which will be then focus of network of expertise? Guidelines, recommendation, think about palliative care, think about survivorship, for example, advocacy, awareness, healthcare, organizational model. There is a big interest in trying to understand which is the best model for network of expertise in Europe, having the request of Europe to behave in a certain way, education of patients, professionals, research promotion, quality criteria, patient and public engagement. And of course, this will be something that has to be fully understood and fully driven by the people that will participate in that. Let's focus on the high-tech medical innovation, because you are part of this, of course. So in the high-tech medical innovation, you have nuclear medicine, radiomic, innovative surgery, ex vivo testing of agents, cell therapies, and physical methods of ablation. And last but not least, innovative radiation, innovative radiotherapy, which is led by CNAO at this point. So it means that CNAO is helping, is like driving and leading the activities of promoting high-tech medical innovation in a big framework of innovation, which contains very different type of innovations. And here I would say that there is opportunity, like to grow together in the innovation, and maybe there is also the opportunity to be the drivers of innovation rather than trying to take it up in the years. Scope of the network of expertise. Here you have some explanations of what it means, for example, cell therapies for advanced therapeutics, collection of human bodily material for clinical application, and so on. So very different applications. Here, what are the aims that has to be achieved? Availability of rapidly advancing high-tech medical resources to all patients across Europe. It's all about accessibility, better treatment and outcomes, and more rational treatments being made available, and bridging the common challenges across domains, including better education, shared competence among clinicians, as well as critical infrastructure. So I think that here the challenge is really to put the people together and try to move the field as of course in terms of innovation, but the field of oncology. Intended impact of the network of expertise is mapping clearly the current situation, identifying the gaps, formulate the most urgent needs, facilitated the training, develop patient-centered pathways, conceive public health awareness campaigns, build partnership to be at the forefront of innovation, which would be the challenges, of course. So here, Europe is inventing a new way of working in the community. So we will have rare technical platforms. I don't have to tell you. We will have rare human resources, very costly resources, or at least costly resources. We are aware of uneven access to various technologies. And of course, there might be a problem of accessibility. Here you have some of the synergies between the network of expertise and the European Reference Network, the cancer centers, the scientific societies, EU official bodies. So there are a lot of opportunities to bring people together in order to shape the new way in which cancer care will be delivered in the next future. Here are some of the participations, the member states that are participating. I have to remember you that it has been the member states that has said to Greece, for example, to Italy, which would be the institution that participate to network of expertise. So this has been something that has been decided by your member states, by your government, okay? And so here you have the innovative radiation is led by CNAO and together with Unicancer in France, and we do have many other partners, of course. And here you have some of the specific objectives of the network of expertise, which are common to all domains, the 7 domains, and then there are some specific objectives. Of course, I will not go into details of that. Here are some of the partners that are represented in the innovative radiation, and so clearly we do have a very broad representation of the different partners. It was asked to the partners to understand whether they would like to participate with a low contribution, with a high contribution, or as observer, and so they have decided how to participate. These are some of the tasks that the network of expertise has. Especially the innovative radiation. So we will start from mapping innovative radiation, exploring future roadmap agendas for radiotherapy innovation, methods and implementation, and so on. And we do have plans for education and training, and of course for dissemination and sustainability. So I think that some of the aspects that we will have to consider is about if we would like to implement, for example, in such a model, a value-based approach for radiation, for innovative radiation, whether this is something that can be pursued for the future, or whether value-based oncology is something that it's a post-hoc analysis. And here innovation cannot rely on post-hoc analysis, should really have a driving force to be implemented. Here, which are the timelines of this joint action, European joint action. And of course, we will start with a survey giving a snapshot on techniques and technology available in your center. So everyone may be part of this survey, snapshot on oncologist perspective on radiation innovative. Here we are asking doctors what they think, and a snapshot of costs. I would like to, this is my almost last slide. There will be a green paper reflecting on challenges and opportunities of network of expertise. So basically, we do have questions at this point, but these are questions that we have to answer to in order to be able to construct this network of expertise, which is a request by Europe. So contribution to research on networking. So how can this type of network provide evidences that it is useful to work in a network in a way that includes networking? added value on the selected topics. Remember the 7 topics: palliative care, survivorship. Is there an added value to work in a networking form of activity to answer the questions of palliative care, for example, innovative radiation or whatever? Ideal models to work out in these different domains. Integration between European health networking and member states. This is difficult. Up to now, the member state has decided who should participate, but the integration, you know that healthcare, it's not in the remit of the European treaties. So it means that healthcare stays in the member states. At this point, the member states has said, okay, in my remit, I ask you and you to participate in network of expertise, but nobody knows at this point which will be the balance between this health network in the member states. Sustainability, funding, who should fund this network of expertise, because it is said that we will have to work for 4 years and having this network in place, and then we will retire. The people driving this network of expertise will be retiring in order to give the network of expertise to stay, and there will be a problem about integration between healthcare and research, and of course patients' involvement. So I would say, in summary, Eurocan is a reality. Eurocan is a success of the European request to work in a different way, according to networking. On this path, Europe launched 2 joint actions to support a new way of working. And here I do think that there is like a big opportunity for innovative radiation to be the driving, conceptualize, drive, shape, and develop the way in which innovative radiation will be implemented in the oncological community. Thank you very much for your attention.
Thank you, Lisa. Questions? If not, I would like from you a comment on the registry. I think that collection and availability of data is of paramount importance. How is this problem faced, and where we should work in order to improve registries?
So Europe has asked us to work through registries, and indeed, for example, CNAO and within E3+, CNAO designed a possible registry, which is not only for head and neck cancer or for sarcoma, it's a general registry, which use standardized language, which is ICDO, for example, a very oncological, clinically driven, I would say, type of registration. And of course, the expectation is that every discipline may have to introduce its own fields in order to go deeper into the capturing of different data. We do have, as CNAO, we do have an experience, but also not at CNAO, also at Istituto Nazionale dei Tumori. We are like working with this starter project, which is a European project that put together registries on sarcoma and on head and neck cancer. The idea, basically, since Europe has asked us to work in this way, there will be, like, I think, more registries, and there is like really a push to have registries. The point is that there are people that are not really thinking about registries as a solution, and I do think they are right, because we are all waiting the way in which with the electronic health record, we might be able to extract automatically this data. But I don't think that the community can wait 10 years before we do have common electronic health records to extract the data. I think the major advancement that has been done at this point is this federated learning, because this is completely overcoming the problems of the GDPR and privacy issues in the different countries. So it means that you keep your data and you just give the data in an aggregate way to answer questions that Europe may have, or the network may have.
Thank you again, Lisa. Let's thank the speaker again.
Just one more minute, please.
Yeah, here closes the session in this room, but I just wanted to remind you that in the main auditorium, Professor Roberto Orecchia and Arnold Campos are giving a presentation in the framework of the Aristotle Medical Forum in the session of the role of artificial intelligence in radiation therapy. So I encourage you to just step in the main auditorium. Thank you very much.